My question is directed to Sheikh Yusuf. Um, on his chart, if I read it correctly on his slide, he said that termination of pregnancy would be permitted for abnormalities, and he listed things like anencephaly, but he also had Down syndrome. And if my understanding is, because we do see Down syndrome more often than we see anencephaly. So if a patient came along, Muslim woman, and said that, yes, I've been diagnosed with this trisomy 21, and what's your advice, doctor? So I, as an obstetrician, would I, as a Muslim doctor, advising a Muslim patient, say, yes, it would be permissible for you to terminate this pregnancy?
Okay, Bismillah ar-Rahman ar-Rahim. This is actually a very good question, because the practical one is happening all the time. You know, I want to be upfront that I'm not in the field of issuing fatwa and legal rulings. But from my reading, and Sheikh is obviously more knowledgeable than me, and Professor Fadl also will bear me out on this, is that I think this type of question should be deliberated with a mufti or a scholar you have and the family have great trust in. And you know, what I realized is that there's lots of you know, conscious involved in this. A lot of people do things not necessarily based on Sharia, but based on their feelings of life and not life. And I think this question should be directed maybe Sheikh himself. Yeah. Sheikh himself can shed some light on that also.
What we do, I'll ask you all to first give an input, and then answer that question, and then if that question is not answered, then you could answer. Okay?
Assalamu alaikum wa rahmatullahi wa barakatuh. I mean, the presentation was for Dr. Yusuf Amir is here, so the question actually should be directed to him. You know, he's just transferred the liability to others, and our brother Dr. Muhammad here is just like democratized the liability now to all four of us. So let us understand what is happening here first. The second thing I would say is that I'd like to focus on a methodological issue, just responding to your question. And I'm going to say this up front. It's, you'll find many scholars, many fuqaha, many jurists giving fatwas on many different topics, halal, haram, wajib, etc. And I think although this is useful and very beneficial, what we need to do is to empower our minds to think through issues as well. So my responses will be about legal thinking, to try to get inside the mind of a jurist and how he or she, predominantly he, unfortunately, would be thinking about such issues. So when you said that, for example, the way you framed the question that, you know, I as a doctor, would it be fine for me to give a sort of a verdict or opinion of permissibility, I would say that this isn't the domain of the medical profession or the medical practitioner. I think there's two domains here. There's the domain of the text, there's the domain of the context. Domain of the text is the ruling based on the primary sources. The domain is and this is the domain in which the fuqaha navigate. The domain of the context is the waqi', is the reality in which the nas is to be applied. And for there is an authority, and no doubt medical practitioners are authorities, or many of them are authorities in this regard when it comes to diagnosis. So for example, the International Islamic Fiqh Council, when they allowed or gave a fatwa of permissibility, they also made it a condition that there is a committee of 2 trustworthy, competent medical practitioners to also support and substantiate the potential threat that the mother may be facing. So here, what you see happening here is that the diagnosis of the situation vis-a-vis whether there is a potential threat or not to the mother's life, well-being, regardless of the levels of degree, that decision is to be made by the physician, the doctor, the person who's in expertise. But the fatwa of permissibility or impermissibility now goes back to the faqih. So it's a conversation between the faqih and the medical doctor, between the medical doctor and the faqih. So the faqih is not going to diagnose and say, oh, this doesn't cause any harm to the mother at all. I don't see that if we don't abort, or if this pregnancy is not aborted, that there will be no harm. That's not the domain, that's not the takhassus or the expertise of the faqih. Nor is it the expertise of the tabib, of the doctor or the physician, to say, oh, I think it's allowed. Oh, I think because of X, Y, and Z principles, there is a fatwa of permissibility. It's a conversation between the two. And that's how I would frame it.
Mohammed, if I can follow on from that.
Assalamu alaikum. The question, as I understood from Brother Hanief Khatri, is whether for Down syndrome you can abort the child or not. Okay. Now, you see what happened, even the question of rape, the fuqaha, in the very early stage, they never considered the mental health as a valid excuse to have an abortion. So when the problem surfaced in Bosnia, when they brought the women who have been raped by the Serbian forces, and they relayed the mental anxiety and torture that they went through, then only the ulama woke up then. They woke up and they realized that there is something like mental health, and then they allowed that you can have an abortion if you have been raped, all right? So now in the case of Down syndrome, so the same thing, whereas our brother here, Yusuf, mentioned that some ulama believes that for Down syndrome, then you're allowed to abort. All right, so in the same thing then, it would be, as he said, mutual consent. The husband and the wife, after having been, they have tested that you're going to give birth to a Down syndrome child, then they must be allowed the freedom or the space to be able to digest what has been told to them by the physician, and then see whether they can actually be able to look after or care for a Down syndrome child. Now, if they feel that they cannot, then in that sense, then they would have the abortion. So that's why the mental health also came into
Okay,
being.
Mohsin, can I just add this? I think where Dr. Hanief Khatri is coming from is that he's in Brisbane. Now, in Brisbane, probably, a Down syndrome child is taken care of by society. Is that correct?
They have very good facilities and care.
Yeah, so then you remember these fatwas were produced or sort of suggested at times where they didn't understand what Down syndrome was and whether the community had facilities to sort of care for these children. Now the awareness is, everyone's aware of Down syndrome. You have Down syndrome societies and you have facilities for them. Is that where you're going with your question?
I'm not relating it to what goes on I'm not relating it to what's going on in Australia. I just question the fact that he had Down syndrome, as I understood it, and as we said in previous IMA publications and conventions, that an abortion would be permitted if the offspring, there was no hope of survival. It was an abnormality that was not compatible with life. Anencephaly is an obvious one. But I grew up with the idea that with Down syndrome, you get a spectrum. You get some Down syndrome who are very badly damaged and mentally retarded and so on. And you get the other end of the spectrum where they are, inverted commas, almost like normal. So under those circumstances, I grew up with the idea that it was not permissible. Okay. Now, when you talk about mental health, this is something, we get girls coming all the time and said, I won't be able to handle this pregnancy. My boyfriend made me pregnant and so on, and I can't have this pregnancy. And they cry, so you say, okay, right, you got mental health issues, so go ahead. So anyone can use mental health as an excuse to have an abortion. If we're going to open it up and say, the jurists say, for mental health reasons, you can have an abortion. So that's an, carte blanche, you can do what you want.
All right, let's just give Faisal a chance there.
Thanks, Mohammed. Just to follow on what Hanief has asked, I'm sure all of us in this room, or many of us, on a daily basis, will see the scenario that Hanief painted about a 14-year-old, a 15, even 12-year-old in our rooms that is pregnant, and it's promiscuity, whatever. But we also see the affairs. Now, following on Prof. Mohsin's mention of mental health, some of our patients have a clear and present risk, not theoretical, just like some of the honor killings that happen in other parts of the Muslim world, that if the husband finds out of the pregnancy, they will be killed. It's not a theoretical concept. There's a serious danger in some of our patients, and many of them are non-Muslim, and maybe that's another question. So the question then remains, in those circumstances, and when you don't help them, as we know, they go to backstreet abortions and then put their lives at risk. And thirdly, the last follow-up on that one is, in those cases, if the consensus doesn't matter, it was promiscuity, so not permissible, whether the woman's life is at risk after or not, then legal in South Africa we have to refer, but Islamically, are we then allowed to say, okay, I can't do it, but here's a guy who will do it, go to him. So we're not pulling the trigger, but we're passing the gun to somebody else.
You want to answer that? No, I think it's for me.
Okay, Bismillah ar-Rahman ar-Rahim. Just to address a few questions, I think Dr. Catherine mentioned mental health, and then we'll speak about promiscuity. I must say I'm very junior to Sheikh, and Sheikh will bail me out, so it's not Sheikh my duty, but because I spoke about it. If you look at the classical scholars, the scholars deliberated on these issues over the centuries, and you cannot just offer a guidelines without deliberating. So these fatwa that have come up, especially the one from the Fiqh Academy in Saudi Arabia, as late as 1990, they were still using 40 days, for example, as the date of installment. They changed it in 1990. They had a conference in the 1990s, and they made it to 120. The point is that it's a very fluid and an area of fiqh that you require intense deliberation by the scholars. And as much as you're saying mental health can then be abused, there was a lot of thinking gone into mental health, and we do see real issues with regards to mental health. And as much as we are used to you saying that Islam is very sort of rigid and it's haram and halal, and it's very unlike that. That we spoke about the one principle there, that al-mashaqqatu tajlibu at-taysir, that the deen is there to make things easy. When there's a difficulty, deen is there to make things easy. And so these fuqaha have done this ruling, have deliberated on it. And when they say mental health, you need, again, two qualified experts, and I would say it would be psychiatrists who would decide whether this mental health is a mental health issue or is a social problem. To come to Faisal's point, with regards to promiscuity, again, I must say, there's such a vast difference of opinions amongst fuqaha. One of our fuqaha from the Indo-Pak subcontinent actually ruled on this, and he did give leeway for a woman who had committed zina to have an abortion. This was Mufti Mahmoud al-Hassan Gangoy, who was a very prominent Mufti. So I'm quoting his fatwa. His fatwa was that, so what I'm saying is that you may find that a bit odd, and this may stand out for you, but this issue is based on deep deliberation by the scholars, and that's why I cannot even legally give you a fatwa with regard to Down syndrome. It's best discussed, and as Sheikh encapsulated very well, it's a dialogue between the experts, and not just an ordinary practitioner, the experts in field of obstetrics, and the expert in the field of Islamic jurisprudence, and they come up with a fatwa. Okay. Sheikh, I'm sure you want to add on that.
No, just to add to that, normally in these kind of situations, the jurists also invoke the principle of akhafud dararain as well. So if there's two situations, from the legal maxim that was just shared here, the actual maxim is a dararu yuzal, that harm is to be removed. Everything else that then falls under a subset of that cardinal maxim. So from amongst those subset of principles of ad-dararu yuzal is al-akhdhu bil-akhaf ad-dararain, by adopting the lesser of the two harms or the lesser of the two evils. This is done by a process known as fiqhul muwazana. This is the fiqh of trying to balance between two options. Now, this is not a direct answer to your question, but it's an answer, as I've said, my answers are going to focus on juristic methodology, on how scholars would think about that. The point about mental health is quite interesting, and I think both perspectives hold weight in that sense. In terms of expanding the notion of health to mental health. Fiqh, as we know, is quite practical, quite visible, and it deals with the outer. And that's why if you see the fuqaha, when they define mal, for example, when we come to maqasid sharia and you define mal, so the Hanafi jurists, for example, they didn't consider copyright to be part of wealth or property, right? Because wealth had to have certain criteria that it meets, and one of them is tangibility, to be able to feel, touch, and see. Now, of course, this is when there's this conversation between the nas and the waqi. To what extent are these definitions fixed? To what extent can these definitions also move based on the change of time and space? So today, if you look at it, when paper money came into existence, there was a whole discussion around the validity of paper currency. That is this a valid form of currency or not? Now, regardless of whether the fuqaha accept it or not, one thing they do end up doing is adapting to the reality that they find themselves confronting. And that's by using many other legal instruments like umum al-balwa and other sort of instruments. So this is quite noteworthy, and it will be interesting to see whether discussions around mental health also move. It is very specialized. It's not just an issue of, it's mental health. We'll also consider that a darar and a life-threatening situation. Remember, we spoke about here, the principle invoked here was ad-daruratu tubihul mahdhurat. Necessities allow the impermissibilities. Now, necessities, there's a strict criteria around necessities as to what formulates and what constitutes a necessity. And it's the highest barometer of life and death, not just harm. It's not a haja. It's not a need. It's not that your life will be difficult. It's not that you'll be in depression for the rest of your life. That's not necessarily a necessity per se. But then again, the scholars also mention, if there's a collective need, al-hajatul amma tanzilu manzilat ad-darurat al-khassa, that if there's a collective need, then this need you would have to deal with on the level of an individual necessity. So it's very particular, very specific and detailed, and it'll be interesting to see how the internal discussions with the fuqaha, with the specialist, move on in terms of the discussions around mental health and beyond.
All right, thanks for that. I hope your question is for Dr. Kadwa.
Dr. Kadwa, yeah.
Wonderful.
To everyone of them.
Okay.
If a patient is unconscious and after some period of time regains consciousness, for that period of time that he missed his obligatory prayers, must he pray those prayers again?
I think that was answered. Go ahead.
Okay, it did say there's a 24-hour time period. So if the patient regains consciousness within the 24 hours, then he has to perform the qaza of the salah. That's my... then it's salah is wait for him.
Okay, I just got one question for Dr. Kedwa mentioned about an Islamic hospital. We have a hospital, right? Though the intention was an Islamic hospital, but it's not, as we all know. But what he has detailed out is things that we can do. These are simple things. I mean, we're not talking about the finances in the hospital. All that is something big. But as far as what you mentioned thus far, that if you get into a hospital, somebody coming and talking to you, telling you how to perform salah, this is available, that is available, there's somebody who will help you. Those things are practical and it can be possible. And I can tell you, I'll take it up and we'll put it at the Ahmad Al-Qadi Hospital, inshallah. Okay, are there any other questions before we move on? Oh, yes, Muhammad Khan.
120 days is a fixed day after which you cannot have an abortion done. Is that correct?
I suppose it's directed to me. So, as I mentioned, there's various spectrum of answers with regards to when ensoulment occurs. So 120 days is obtained from the hadith. The number is explicitly mentioned in the hadith, 40, 40, 40, and that's how they come up with the 120 days from conception. And this is not LMP, it's conception. So effectively, you add another 2 weeks if you were to calculate according to LMP. So, yeah, according to those who feel that 120 days is the date or the exact date for ensoulment, that would be the thought, that life begins at 120 days. So I'm not sure if I understand you. So there's only four, the four views I presented there were the only four views that are currently...
The point I'm trying to say is with this necessity for an abortion,
Yes.
it only could be done up to a certain time.
Okay, I see your question. So as I say, the one overarching necessity is maternal health or maternal life. So if there is a life-threatening condition, it can be at any stage in pregnancy, even at 36 weeks or 35 weeks, but that will become a premature delivery. But if you've got a woman who's eclamptic and imminently, about to lose her life, then you are justified in aborting that fetus at any stage, not necessarily 120 days, 180 days at any stage.
Okay, I'm told time is up. We need to move on.
Just to react to an important point that I think, I don't know, somebody who mentioned about if one scholar doesn't hold an opinion but knows that there's another scholar who holds that opinion, that is it permissible for that scholar to tell the patient or whoever is asking the mustafti to go there? Yes, it is permissible. I recall once, I don't know if you've all heard, one of the great, Sheikh Abdul Fattah Abu Ghudda, rahimahullah, who's one of the greatest hadith scholars, faqih, jurists of the 20th century, when he used to be asked questions about talaq, and the 3 talaqs into 1 or 1 is 3 and all of that, his position was the dominant position, that look, 3 talaqs in 1 sitting counts as 3, not 1. But however, he knew that there were other scholars at his time who used to give the fatwa based on Shaykh al-Islam ibn Taymiyyah's opinion that 3 can be 1 if this 3 is pronounced in 1 sitting. So he used to say to the mustafti, look, I can't give you this fatwa because I don't hold this opinion. But if you want to go with this opinion, go and ask scholar such and such, meaning he transferred the liability to the other scholar. So yes, it is permissible in this scholarly fraternity to engage in this way.
But not to go fatwa shopping, okay?